The Adamawa State government has confirmed that 42 persons have died due to an outbreak of measles. The Commissioner for Health and Human Services, Felix Tamwanwe, who provided an update on the outbreak, said the deaths occurred in Mubi and Gombi local government areas. He said the outbreak affected 8 wards in Mubi and 7 wards in Gombi. The commissioner also gave the death toll of 42 of the 308 affected persons in both local government areas. As part of measures to avert further spread, Tangwanme said all LGAs in the state had been put on red alert. He also said his ministry, on receiving reports of the outbreak, responded swiftly, which was why it was able to be managed to a certain level. Now, to discuss this on the news, I am joined by the CEO and co-founder MyMedicare. That's Dr. Chukwuka Paschal Obodo. Thank you for your time. Dr. Obodo, if you can hear me, let's get straight to it. What are the underlying causes behind the recent measles outbreak in Adamawa State, particularly in the highlighted local government areas of Mubi and Gombi?
Okay, thank you very much for that. In regions like this, a lot of factors come into play. One on the list is hesitancy for people, taking these vaccines. All right, because for you not to get this viral infection, you need to properly, vaccinated. Okay, so there is more like a low penetrance to vaccination around that axis. And also you can, talk about, people moving from one place to another as a result of the Boko Haram, insurgency. That has really, contributed to, having a lot of people, within a crowded region. In addition to that, a lot of children are not, their nutrition level is not optimal. So that, of course, these are some of the factors that really would have contributed to what we are dealing with in Adamawa State.
Now, what specific factors do you think also contributed to the high mortality rate of about 42 persons of the 308 affected individuals, in the outbreak?
Okay, yeah. So most likely is because of low vaccination. All right. For you to really be able to curtail measles, we are looking at a vaccination of up to about like 95%. Even in certain countries like UK, where you have up to like 70 to 80%, such level is still not enough to properly curtail the outbreak of measles. So comparing that to what we have here, which of course people now see some of the vaccines are really there, but many people are not, because of maybe their cultural backgrounds or their beliefs, they are not very much open to these vaccinations. So that really can contribute significantly.
Let's also look at how, effective were the measures implemented by the ministry, the measures, sorry, implemented by the Ministry of Health and Human Services in responding to the outbreak and managing the situation. How would you rate the efforts of the officials and the government so far?
Okay, for me, I would say it has been swift. Okay, starting off from properly reporting the number of cases, and from what I read from the news, because I've really been following this up, there is properly documented. For Mobi, number of cases that they have, the mortality, same thing with Gombe. All right, so and they have actually been able to set up a protocol team that can really follow up, asking questions and ensuring that those people that's directly exposed, they properly receive the adequate care that they need, and of course, properly isolate them within that space of time, preventing it from getting to more individuals.
Now, let's explore also strategies that you feel can be employed to prevent future outbreaks like this, and also improve the overall public health preparedness in the state.
Okay. Well, so number one on the list is vaccination campaigns. All right. We need to, a lot of effort needs to be in place, by governments, teaching people about the need for, for them to really know more about measles. All right. And how this can really be prevented. Okay. And of course, when you're talking about this, you have to relate to them at the level at which they very much understand. Okay. Because, and this will really require collaborative efforts from, religious leaders that a lot of people on this axis will be a lot more willing to, listen to. Other things is, other things are, to ensure that the health facilities are properly, they have what they need to be able to manage cases like this. Because if they're not properly managed, that means even the healthcare professionals that are giving these services or help rendering care to these individuals that are already affected can also get infection and further spread it. Of course, other things I've mentioned earlier, but I still have to stress it again, is community education. People need to learn. People need to properly educated that getting these vaccinations can very much help. From 2000 to date, we've been able to prevent about 50 million deaths from measles, which of course is very significant. So you can imagine 50 million people dying within that like 2 decades, and 50 million people being prevented from deaths, all right, within 20 decades. Between 2 decades rather, and is because of the vaccine that's been put in place. So that's it.
All right, Dr. Paschal, once again, thank you for your time on the news.
You're welcome. My pleasure. Thank you.
All right.
Bye.
Bye. Now, Nigeria.